Excellent. Okay. Okay. All right. Can somebody just let me know that you can see the slide, the slideshow? Can you let me know?
I see it, Nancy.
You can see it?
Yes.
Okay, great. Very good. Thank you all. Okay, I think I've pinned I have a list of things that I'm supposed to do as a shepherd. So I have pinned the speakers. I have pulled up the slide presentation, and I have hit the record button. So I'm hoping that all of that is working right. So, all right, let me just see here. All right. So what I want to do now is I hope you've had a second to read the biographies of our speakers today, Dr. Pamela Teaster and Ms. Stacy Carey, and that they bring a wealth of experience to today's session. And we're grateful to have them here with us, sharing with us today. So without further ado, of course, you are invited throughout the process to throughout this workshop to put your questions in the chat. Dr. Teaster, I think, is going to present first, and then we'll pause after she's done with her slides and take some questions, and then we'll move on to Stacy Carey's presentation. And so hopefully we'll get all your questions answered. Thanks a lot for being here today. Appreciate it.
So, Nancy, you let me know when you're ready.
Yep, go ahead. That'd be great. Thanks.
Okay, can they see the slides for the, I see the one slide, which is sort of our opener, but I don't know that I see the PowerPoint slides. Maybe they do.
Dr. Teaster, I don't see the PowerPoint slide either. I only see the information about us as presented.
Yeah, we see me and the, yeah.
I don't.
What you may have to do, you may have to end this where you're sharing the one slide. You might have to end that share and then go into a new one.
Gotcha. I will do. Oh gosh. Okay. Thank you. Who told me that?
Taylor Shelton.
Okay. Thank you for your help. I appreciate it.
No problem.
How about that now? Does that look like it works? Dr. Teaster?
No, it doesn't.
Okay.
Sorry.
Oh gosh. All right. Well,
Did you click share screen again?
no, thank you very much for that.
You're
Oh
fine.
my
You're totally
goodness.
fine.
I am so sorry.
No worries. Listen, we do this every single presentation we ever have. You are just no. It gives everybody else a chance to feel good about the last presentation. And by the way, while Nancy is working on this, please excuse any barking dog or anything else that occurs, because if I go on mute, I can't talk. But it's not surprising. Perfect. It's not surprising that he might bark because he's sitting right here with me.
How about now, folks?
Yes. Got it.
Yes.
Excellent. Perfect. Okay. Thank you, Nancy. And I'll just, Stacy and I will just say next slide. And that's the if the folks who are watching and attending, that's just how it'll go. And it's a great thing that Nancy is doing this, because I would expect even with that, I'll probably be garbled in sometimes, because I don't know what's going on in the universe, but that's what's happening with my Zoom. Anyway, thank you, Nancy, for inviting Stacy and me to do a presentation on multidisciplinary teams for addressing elder abuse and why they matter. I think you're probably going to really enjoy what Stacy has to say about the multidisciplinary teams in Kentucky, because they have statewide coverage, and that's just huge, as you see from That's not the map of the teams, but that's the maps of the states. And you can see that we still border each other. And I still, even though I've left Kentucky some years ago, I was at the university there, I enjoyed a fantastic relationship with them always, and still do, even across the border. And I hope that all of you who are involved with adult protective services and social services enjoy such a fine relationship with such great people as I have been privileged to have. So I just, I miss them. I miss when I see Stacy, I miss her a lot. So anyway, I'll just start from there. So there's our two states, Kentucky and Virginia. They look a lot alike because they got a lot of counties. And so isn't that interesting? And so that's where we are now. I'm in the small corner in Virginia, Southwest Virginia, which borders not too really far from Kentucky, but I'm in Southwest Virginia, Montgomery County, which is a little county towards the far left of your screen that shows Virginia. And Stacy, you're kind of in the middle of Kentucky there. I assume you're sort of still living near Frankfort or in Frankfort or about there, or at least you're commuting there every day. So when you were, and so that's just to tell you sort of where we are. All right, next slide, please. Thank you, Nancy. What is a multidisciplinary team? Right off the bat, I can tell you that is up for grabs. This definition and question is up for grabs too. And there was some debate about what an M team, a multidisciplinary team does, and why do you need one? So let me just take some of the definitions that have been offered, even in stuff I've written, and everybody doesn't agree with it, understand. But this is a multidisciplinary team and why they're important to have. So I'm sort of your context and background. That's what I'll be providing. So a multidisciplinary team are groups of people from diverse disciplines. And in the context of understanding elder abuse, they come together to talk about cases or strategies and try to address things at a lot of different levels. They address systemic problems, but you'll see that many of them do very different sorts of activities. They are engaged, they emerged, that doesn't have a date, they emerged in the early 2000s as a vehicle to assist communities that had elder abuse cases. And if you have worked those cases, they're exceptionally complex. And just like I'll talk a little bit about this in just a minute, but they began to be too complex and diverse for any single discipline or agency to resolve. One, it was not like our Pfizer vaccine. It was not a one-shot wonder that you could administer, or like the J&J vaccine, the one administration, and you could resolve the problems of an older adult who in fact may have been in a situation of elder abuse for years. And then allow people to talk about and coordinate intervention procedures, because I'm sure it's not the case for you in North Carolina, if that's where you are, most of you I assume, that you have enough funding for everything that you need to do. And so by combining resources, you were able to address a problem. So there are people who believe that multidisciplinary teams are only about resolving case situations. Others see them more expansively as providing education, as coming together just to discuss system problems, of working on legislative issues, regulatory issues, policies. There are a whole set of people who see multidisciplinary teams quite differently. I'm your sort of expansive professor on multidisciplinary teams. And I might add, multidisciplinary teams really have gone the way of a lot of the way we now do work, as a matter of fact. You are hardly ever a sole source operator in doing the work that you do anymore. And I'm really glad about it, although there was a study I remember reading about how many people work well in teams, and it really was a smaller number than you might believe. So it turns out that many of us human beings don't really like to do teams. My students, when I learn they're getting a team assignment, they usually kind of draw back in fear of how that's going to go, and rightly so, because sometimes it just doesn't pan out, and assigning a grade for them can be difficult. But across multiple sectors, the business sector, for example, hospitals, social services, social work. I think what we see is these human problems, the problems of the human condition, have become exceptionally complicated and really maybe are made better by people who see the world differently than perhaps just you do or I do. Even in the professorate, which is what I am in, we moved from being a single author of a publication, and this would have been really before I became a professor, but there were a lot of people who just wrote by themselves and they published articles, to a string of people now who are involved in multidisciplinary approaches or interdisciplinary approaches or transdisciplinary approaches to problems. So really the very nature of how we do work informs the multidisciplinary team approach to addressing problems of elder abuse, which are, I think Kate Wilbur and I have both written that we would call elder abuse a wicked problem, one that really doesn't have necessarily one right answer that you're going to see cycle back from time to time. We have written and called that issue a wicked problem. It has its basis in business, as a matter of fact. More than you wanted to know, maybe, but I thought you might want to know about the genesis of what the whole sort of multidisciplinary movement and why multidisciplinary teams on this topic have really, their genesis is much earlier for accomplishing and tackling a variety of problems. Okay, great. Next slide, thank you. Okay, so big question about multidisciplinary teams, and if any of you have ever had the delight and pleasure of working with Georgia Annisberger, we had this discussion, and the question sort of was, well, do they work? They do take more time than you're coming up with one single solution to something. And so the question sort of sits out there, is like, if we're going to go to all the trouble of bringing all these people together to work on one issue or problem, have them meet, have them all come forward together to think about an issue and roll through a set of cases, and generally unfunded, does it work? All right, so this sort of began the question that I and others have explored about that very issue. If you have a multidisciplinary team, are outcomes better? And here we are. Next slide, please. So pretty early and now, more than a decade ago, with a colleague of mine, Lisa Narenberg, we attempted to answer this question for the first time. And I think that, to my knowledge, it was. This was around the country. We collected data from 31 team representatives. And that was to try to understand what the teams did, how they worked, did they seem effective, did they even evaluate how they were? And that is what we tried to do. And we learned there were all kinds of different sorts of teams. Some of them were more expansive in their roles. Some of them looked only at elder deaths. Some of them were very focused on healthcare outcomes. There were all sorts of different types of teams that even had emerged by that time. And we were sort of trying to see what was common among them and what were their, how effective were they? How much did they cost? Were they funded? Did they have to have a budget? How did they have agreements and so forth? So that really was some of the early work that Lisa and I did to try to understand teams. And we published it and we presented our findings at a number of conferences. We published a paper on it, and I think it's even actually in the book. So, in research. So what we tried to do was look at trends and look at the challenges that teams face and the good things that occurred. We tried to look at service gaps and learn how members got educated or learned about ways to do work and how to help people. That we wanted to know, for example, was legal expertise important, and was that an important piece to have on teams? What did it cost? And they really varied widely. Some of them really cost a lot in opportunity cost time, but really got funded in no way. But we did learn that actually the teams were pretty important in a community's response to elder abuse and were quite valued. But there were a lot of gaps. There were, because many were not funded, we learned that team members probably started off with all good intentions, and then when work became when work moved from a valley to a hill to a mountain, they just simply couldn't make an unfunded mandate. And so those were problems that teams faced. And when, for example, a key member couldn't come, and I think the key members of teams I've been involved in have always been law enforcement and APS. And when it turned out for some reason that the APS person got called away or the law enforcement person couldn't come, the team sort of dissolved. We all drank coffee and pretty much talked about, wasn't this a terrible problem, and walked out the door. So key members who were really important in presenting cases or insights who through no fault of their own, but just simply the way their work went, who couldn't come for a particular reason, it really disrupted the momentum of the team. And again, I say no fault of their own, but just the way it went. So many teams, when they were all when the teams were really about trying to resolve abuse cases, that's really what they did. They had a case, they had to address. Somebody presented it in a sort of way that would resemble that for APS and maybe some of your classes where you've looked at a case study and you tried to resolve what to do. This is what the primary goal of those particular problem-solving teams were about. Okay, next slide, please. And what good are they? All right, because we wanted to sort of see, were they really useful and helpful? In fact, they were. So one of the things was they strengthened community relationships, and that was really important because, as many of you I know, it's not only it's the statutes and the regulations and the policies that can help strengthen and create teams, but it's the relationships that you have. For example, on this very presentation, it will only be enhanced by what Stacy has to say, and that's because I got to know her through doing elder abuse work. And that is how we learn and get to do all kinds of important and good things. Because you got to know people, you got to know them as human beings, and you eliminated or ameliorated some turf wars. And, you would learn as you sat beside somebody you had thought was uncomfortable to you, you learned that they were, by the way, the great human lesson of they're human beings after all, operating under their own set of policies and programs, and they could or could not do something. I think sometimes we, in elder abuse or I have not been an APS worker, I only know them and study them, but I know sometimes my APS colleagues get frustrated with law enforcement and for maybe not law enforcement as much as they get frustrated with prosecutors. And the old issue of, well, we get this case ready and then they won't prosecute it. And I think having a prosecutor in the multidisciplinary team, along with APS and sometimes the docs and the banks, really help you begin to sort of see what the issues are about. They don't necessarily want to prosecute it. They can't win it. And so what needs to be done, for example, that might enhance bringing a case forward to begin with. I remember one of my colleagues, and Stacy, you'll know her, she used to say, give me pictures. I need pictures so I can prosecute the case. We will not say her name, but we all love her. And so I remember she said, I need pictures to be able to prosecute. Why am I not getting pictures? So I think sitting around the multidisciplinary team began to sort of say, we need some pictures to help do that. And maybe that will enhance things and create things. So promoting teamwork and assistance. So, usually when you get around a group of people, you work a little harder to work together when you get to know them better. Then another one was providing assistantship on cases referred for guardianship. That's another whole lecture and presentation itself. I won't go there today, having just been on a big national conference on guardianship just last week, and I was with a couple of your North Carolina colleagues. One of them, the man I just think is a great scholar, thinker, and wonderful attorney. If anyone of you know him, Frank Johns in North Carolina, and he was in that group just last week. But that is its own set of complexities. Help people get legal services they understand, help people get improved medical care because now we are aware of what resources might be, enhance people to understand what you can do and what you can't do, and then use the bolus of people there as the great inoculation or the beginning of that to try to address the problem of elder mistreatment. in many and far more creative ways than you're going to think of, and any one person could think of on his or her own and get accomplished. Next slide, please. So that's just a placeholder. So the National Center on Elder Abuse began a community coalition project, and this has been some time ago, but here's what they wanted to do. So next slide, please. You remember, I've just used AOA, and that has changed to ACL now, but that was what it was back when we did this work. What they really wanted to do is try to figure out whether multidisciplinary strategies work. They wanted to understand what elder justice coalitions did and how they function. Could they be replicated? That was really important. Did you have to have, what did you do about confidentiality? Because that was sort of a huge issue that we thought at the time. And then again, trying to understand in this particular project, and this has been a number of years ago, that really coalitions are really quite important in communities responding to elder abuse, and people who participate in them raise their awareness, raise their understanding, and get value by what they do. And the strength of them is in a really important way of pulling together a wide set of a wide berth of people from a wide variety of scope and confronting elder mistreatment. So next slide, please. Next slide, please. Now, Stacy is going to talk with you about this much more, but bless them, even back in the day, we were funded, and we did some of this work at the University of Kentucky with Kentucky because they had such an unusual set of local coordinating councils on elder abuse, because they had such an unusual and interesting arrangement in the state and early. The Administration on Aging funded us at the University of Kentucky through the National Committee for the Prevention of Elder Abuse, part of the National Center at that time. That's a mouthful, but that's a longer discussion than this presentation. But at that particular time, the National Center on Elder Abuse actually was a set of a partner arrangement rather than the arrangement now, which is all housed in one place at the University of Southern California. But at that time, the different partners did different projects. So the National Committee for the Prevention of Elder Abuse subcontracted with us at the University of Kentucky to do this work to study LCCEAs in Kentucky, because they were such a promising and interesting set of kind of different kinds of multidisciplinary teams that had arisen and had sort of a long history in them. And Stacy was in charge of them for as long as I knew, that I ever knew about it. And Stacy was in charge of these, and so that was really a wonderful arrangement to get to be able to study a group of people in your own state who are doing something really pretty cool. And she'll tell you about it, so I won't do a spoiler alert on what she's going to say. But the importance of this project was to try to understand about replicability of LCCEAs in other states, and to sort of see what they were accomplishing. And then, if that was the case, to develop a manual that we could replicate to other states who could begin to use it to develop their own sort of system in this way. So Stacy will tell you more about this. This is just a little bit. They were established in Kentucky in 1998. So that was some great vision, in my view, to work on cases of elder abuse. And they really were a grassroots effort to develop responses to these issues. So they recognized really early of the importance of having these kinds of councils to address multidisciplinarity on the topic of elder abuse. So it was really quite forward-thinking of them. Next slide, please. So we did study them, and Stacy, in fact, helped me think about what the findings would be and how to conduct a project, and they all answered questionnaires, which seems like more and more people in the world have had to do for me, and thank you if you have. But we learned that they were really, at that time, the LCCEAs were really very diverse, and some of them didn't have this was from their own reporting, that they didn't have a real purpose for what they were doing. They kind of had a scattergun approach, and and many of them commented that they needed more coordination with their efforts. And then they needed, this is the sort of historic problem with multidisciplinary teams. They really had to have certain key people involved in the LCCEAs to make them work. This is also true for multidisciplinary teams. It's some of the hardest people to get involved. And when you get them, you got to keep them, figure out a way that if one person leaves in a slot, you keep them around. They needed funding, and I think this is a problem for all multidisciplinary teams, often an unfunded mandate, and everybody's good feelings and good wishes can only go so far to help people get there. When the crisis arrives in your job suite of work that has to be done, then that person can't attend. And then they needed recognition, and they needed some more direction. And I know Stacy will tell you about how some of those things got addressed later on when she talks. Next slide, please. Thank you, Nancy. All right, next slide, please. So here is what I wanted to sort of say about this evolution that I talked to you about earlier of how why we have moved in this kind of world. And so that we are trying to even move into transdisciplinary, an important way to solve complex problems that not just interdisciplinary, or that we begin to try to understand the discipline, or that we are multidisciplinary in that we've got people from other disciplines attending, but we really kind of move beyond that sort of thing and become our sort of own body and group. And so transdisciplinarity is that sort of lofty goal where actually transdisciplinarity is becoming something different, because you didn't just show up to be a lawyer and you're always going to stay with the legal approach, but you do begin to understand and morph into a team, a group of people working on the problem of elder abuse in our area. And that is sort of a lot about what transdisciplinarity is. It doesn't occur easily, I would just say, but it is right for the issue of elder mistreatment, because it is everything, multiple problems that arise within the context of elder abuse. They require interaction. They are reciprocal. They exist at multiple levels. And then there are a number of transdisciplinary research networks, and you can sort of see those funders that you have heard about, I think, before in other venues. Next slide, please. So some recommendations about some recommendations that we had that would have to do for multidisciplinary teams that are really important. Be honest and recognize the costs of them, even if they're opportunity costs. What is that going to mean? What kind of options could be supported for it? And another one of those would be like, let's say if Stacy had to come to a multidisciplinary team meeting and she got called away because the governor's called her to do something on elder abuse, then have a backup for her and have that person designated and a little bit knowledgeable about what she's doing, rather than sitting at a table of a group of people trying to solve a problem and not having a clue about what's going on. Engage the needed disciplines and make it work for them to continue with participation. That may mean that you have to have the meeting at certain and particular days and times that fit for people. We are now in the Zoom environment, and so probably never has that gotten better than now, because we have been forced into a new mode of communication. But the nice thing is it has created some new modes of communication that make it more possible for people to attend. And then we think that it's really important that you look to see if what you're trying to accomplish is actually getting done. For example, how do you measure success? Just to have a plan and to sort of be loping along with it is one thing. That's good, but better is to see, did you accomplish what you set out to do? And what sorts of metrics did you mean to have as far as the accomplishment of them? And that's how you'll know whether, like a professor would be, I give you the syllabus and you get a grade at the end of the class. Except the issue of elder abuse is far more than one single class period in the semester. All right, next slide, please. So goals for the future are still goals for multidisciplinary teams, even in the research that I have done that's been a little bit ago. To continue to bring in community partners to increase awareness of elder abuse and begin to think very creatively about that. There was the day Stacy, and now I think people are actually doing this. There was the day when my wonderful guy who cut my hair, I guess he will not mind, Will Locke in Lexington, Kentucky. When Will was cutting my hair, that it dawned on me, and I'm sure it has others, that who wouldn't be a greater person to actually be trained to sort of think about elder abuse than a hairdresser? Because if an older person actually got to get their hair cut, you are very proximal in the space of a person who was a hairdresser. And many of us know that we talk a lot to our hairdresser. And that is often a very safe space to be able to talk. And so Will actually did some work on getting the association to, getting me the information about the Association of Hairdressers to begin to talk about this issue. And they did, in some states, begin to act on this. So thinking of those partners, I can tell you that the financial industry wasn't always at the table early on in multidisciplinary teams. And so now you wouldn't be without the bank folks. But quite frankly, early on, it tended to be a doctor or a nurse, probably more often not a doctor, but because you probably couldn't get them to come because of the time issues and when maybe people were having meetings, but it would often be somebody from the medical community, somebody from the law community, and a social worker, if you could get them. And if those three in a room, well, those are key disciplines, but there's a lot of others to think about when you want to talk about the problems and issues. Domestic violence then came along, but that wasn't necessarily part of the group early on. Sane nurses came on later as we began to think more expansively about those issues. And so the groups grew as we understood the complexity of the problem. And think of it, an interpreter for people who don't speak necessarily English, but we need to understand the problem of a person who might be Hispanic or Polish or Chinese or Asian. So educate the public is another goal. There was a day I drove down the road in Nicholasville in Kentucky, the Nicholasville Road, and looked up, and there was actually a road sign on elder abuse, stopping elder abuse. I really pulled over the side of the road and just cried for a minute because I realized how important it had come, how long we had come, and we were actually being able to do that. And would you believe, about a week ago, a colleague in Virginia showed us that they were doing the very same thing. So what goes around comes around. It's great to know. Continue to grow and be active in the community and increase involvement in councils. Next slide. So a little update, a little more on MDTs. Today, financial exploitation is one of the most important things that we hear talk about, that has become a huge issue for elder abuse. You'd almost never have a study without trying to suss that out. And so costs victims $30 billion each year, wrecks homes, wrecks families, makes it impossible to do other tasks. And then we learned that necessary agencies must be on a majority of teams, and law enforcement is really critical to that. Medical professions, you can kind of see victim advocates came along, public guardians came along, AAA folks came along, mental health services have come along, all kinds of important people have been added to MDTs because we understand the importance of them. Next slide. Members of MDTs feel that they personally contribute to victim safety because they have a hand in it and can contribute their expertise to it. These important goals of person-centeredness. I'm sure it is Carl. Connie's probably best I can do though. Person-centered goals are part of that. Ability to accomplish goals because you have the necessary people together and expertise in the ability to do work. Next slide, please. Challenges. I think I've already spoken a lot about these multidisciplinary teams. But multidisciplinary teams have trouble keeping members on them. Sometimes there are language problems that occur. Confidentiality was an issue. Funding is an issue. And then when there's no funding, other things come to the wayside. There are not necessarily agreed definitions about what it means when they succeed. And then how much time do we just spend talking before we do something? So I can see from the chat that sometimes my audio is garbled. It's just the best I've got right now. So apologize for that, but it's the best I have here where I am. I'm going to stop there and take questions if anybody has them. And maybe I can even put it in the chat if I need to, if you all can't hear so well. So I'm going to stop there because that's my portion of it, and I'm going to pass over to Stacy after anybody has anything to ask or comment on.
You seeing any questions, Dr. Teaster?
Let me look here. Not right now.
Okay. All right. Well, we'll say, we've got about 25 more minutes, so we'll rock on with Stacy, and any questions that come as Stacy's talking, we'll try to answer those too. Okay, Stacy, I'm ready.
All right, thank you. Can you hear me okay?
Yeah, can hear you great.
Thank you, Dr. Teaster. Thank you, Nancy. Good morning, everyone. As Dr. Teaster mentioned, I'm going to talk about Kentucky's local coordinating councils on elder abuse. So when we move through the PowerPoint, you will see LCCEAs is our acronym that we use for the local coordinating councils on elder abuse. So we'll go ahead and get started. Nancy, if you can move to the next slide, please. When talking about the history of the local coordinating councils on elder abuse, they were established in 1998 through the Kentucky's, as a result of Kentucky's statute 209, which is our adult protective services statute. Later in 2005, House Bill 298 kind of reestablished the Kentucky Statewide Elder Abuse Committee, which was to provide oversight and guidance in addressing issues of prevention, intervention, investigation, and agency coordination as a multidisciplinary response to abuse, neglect, and exploitation. And through this statutory enforcement, the committee recommended the statewide councils to, I guess, revitalize and to focus on the work that the councils were doing throughout the state. So currently, I think the councils in some form or fashion, we've had councils in effect in Kentucky for a little over 20 years. As part of the councils, the work for the statewide elder abuse committee, they also developed a model protocol. And this model protocol can be found on our cabinet's website. As you can see, we provided the link to the website. The model protocol offers, it has a wealth of information. It offers goals, how to get started. It talks about membership. I think Dr. Teaster talked about this earlier. You know, who do the councils want to have at the table? Not just adult protective services and law enforcement, not just the agencies and the community partners we think about, but maybe even, you know, if you want your beauticians, we've talked about having EMTs, firefighters, anyone that would, you know, comes in contact to our most vulnerable, doctors, nurses. So the model protocol offers that structure and planning. It's a wonderful resource. I was the liaison for the coordinating councils for several years before advancing up to being the branch manager for our protective services branch. And oftentimes I would get questions from councils about how to, you know, they were kind of stagnant, how to revitalize themselves. And I would often refer them back to maybe the model protocol, would offer some resource information. So it is as I stated, it's a wonderful resource that we try to promote for the councils that are currently active and for any of the counties that we have in Kentucky that maybe are wanting to start a coordinating council. Next slide, please. As you see here, this next slide is a map of the coordinating councils here in Kentucky. The map is found on our cabinet's website. This map offers contact information. So the individuals listed on the map are either a council chair, co-chair, or someone within the council who is willing to be the contact for that council to answer any questions. So if anyone has any questions about what's going on in their community, or if they want to know about how to become involved in a coordinating council, they can contact the individual listed on this map, and anyone can reach out. As you can see, and I'll talk about this as I advance further, some councils only cover one county, some councils cover multiple counties. So this map kind of gives individuals an idea of what counties are covered in their area of state, and who the contact is. Next slide, please. Currently, Kentucky has 120 counties, and as of now, there are 24 councils, as you saw on the map, that cover 93 councils across the state. The councils are independent from one another. They're not administered through the court or cabinet. Kentucky's Department for Community-Based Services has for years. We've been a resource by facilitating and offering communication. We have the liaison position on the adult protection branch that really works to facilitate and share information with the councils throughout the state. We also have APS staff that participate. In addition to DCBS staff, we have our Department for Aging and Independent Living staff who are within the cabinet, who also participate on the councils throughout the state. The coordinating councils are a group of professionals, I think as Dr. Teaster talked about MDTs. They're from diverse disciplines. They coordinate, they come together and they meet, they educate one another on resources that in each other's agency's role in promoting elder abuse awareness and prevention efforts. The councils play a key role in the communities here in Kentucky in our response to elder abuse awareness and prevention efforts. Next slide, please. Some of the activities that the councils participate in, they're reflective of the communities that they serve. Oftentimes, their primary focus is intervention and resource development designed at trying to end abuse. The councils across the state participate in a variety of activities such as MDTs, promoting public awareness, hosting conferences, offering trainings. They distribute news blurbs throughout the newspaper, radio, and television. Some of the councils, if you review the map, we have Big Sandy, Kentucky River, Northern Kentucky. These are just a couple that they have Facebook pages that they have that are designed for their council, and they utilize those pages in an effort to share any information that they may receive from NAPSA or the National Center on Elder Abuse, the Administrative on Community Living, and anything that they have going on within their communities. As we know, May is Older Americans Month, and June 15th is World Elder Abuse Awareness Day. So a lot of the councils throughout the state of Kentucky are planning events to promote and educate the public on elder abuse awareness, prevention efforts, how to report, where to make a report. They have conferences throughout the years. They even collaborate with schools to do poster contests to get kids involved in, elder abuse awareness and prevention efforts. So throughout the year, they work on a variety of activities. Next slide, please. When we think of multidisciplinary teams, the councils themselves, several years ago, a couple of the councils did have subcommittees where they worked as an MDT to actually discuss reports, adult protective service reports of abuse, neglect, and exploitation. But I think in communicating with the councils recently, I think most of that is phased out. Their main role is coming together as individuals from different departments, agencies, and even seniors to kind of talk about what they identify as needs pertaining to the communities that they're serving. However, they do have separate meetings. So a lot of the councils you will see, they have member adult protective services, law enforcement, Commonwealth and county attorney participate on the local coordinating councils meetings. So they have a separate meeting. Some of the councils throughout the state, some of the individuals participate on multidisciplinary teams through their Commonwealth or county attorney's offices to actually review and discuss any kind of APS cases. And then with regards to the coordinating councils, they may come back, they won't share anything because of confidentiality, but if they're seeing outliers, if they're seeing a lot of different types of cases come through, they may talk about that within the coordinating council to discuss if there are other ways to educate, such as if they're seeing an increase in reports of exploitation, they may decide that, maybe that's an area of focus that they want to focus on, educating the community, maybe doing trainings, working with banks to offer any kind of public awareness training and how to report what are indicators of exploitation, things to that degree. Next slide, please. Some of the challenges that the coordinating councils face are, as Dr. Teaster talked about when she did her study, is lack of participation by certain groups. I think each council is different in their membership. Some of our councils here in Kentucky, they have doctors, they have, their local fire department in addition to law enforcement. Some councils aren't as diverse. They don't have as many, the participation is not as large. So sometimes that's the questions that we get. We try to work together for those councils that do have a large membership, how have they achieved that, to share that information with other councils. Some members don't participate regularly, and that can be for a variety of reasons. It may be because the individuals, for instance, Adult Protective Services, as Dr. Teaster mentioned, sometimes our APS staff may not be able to attend the meeting because they may have to be out, initiating or working on reports. We've talked about ways to make meetings more convenient or accessible. I shouldn't say convenient, but make them more accessible. And especially, I think, with COVID, everyone's learning with the advent of utilizing technology now through Microsoft Teams and Zoom. So we talked about offering meetings through the virtual platform, offering conference calls, even maybe changing meeting locations to see if that will work. Money has also been an issue. Fundraising has been discussed throughout the years. So as we've progressed in trying to communicate with the councils, myself and my staff, the liaison currently on my branch, as you'll see on the map, the liaison position is Cliff Bryant. And the meetings that he's had, we've discussed, funding opportunities. We have an annual recognition event each year. And we've talked with the county councils about ways to raise money, fundraising. One year we had someone come in that talked with the councils about developing how to start a 5K or a 3K, how to start a race in order to promote awareness, in addition to utilizing that as a fundraising activity. So those are some of the challenges throughout the years that the councils have expressed. Next slide, please. I think I've mentioned this throughout the presentation. Information sharing is a key part of the success or trying to be successful for these councils. How do they gather and share information? The liaison for the statewide councils, in an effort to keep the councils connected, the liaison will host a quarterly call, whether that be through Zoom or Microsoft Teams. The call has a set agenda, and oftentimes the council chair or a contact is invited to participate. They're also invited to share prior to the call any information, anything that's going on within their area of the state that they want to talk about amongst one another, or anything that they have planned, any events. They share those ideas. That way, if something is occurring in the eastern part of the state, the councils in the western part of the state, they can take that on and start utilizing any ideas or ways to promote awareness in their area. The liaison also has an email listserv, and through the listserv, the liaison will share information, emails, anything on a national, state level that pertains to elder abuse. Any conferences, trainings, anything that is being sent out by NAPSA, or the National Center on Elder Abuse. And as I mentioned before, we try to host a recognition event each year. And that recognition event is an event that the Adult Protection Branch, we try to put on for the statewide coordinating councils. We try to set it somewhere centrally located in the state. We invite the councils to attend the event. We try to have speakers there and offer those speakers, offer speakers that are going to present on topics of interest. We've had speakers that have talked about, as I mentioned, establishing a 5K race. We had speakers who came in the past to talk to the councils about MDTs, multidisciplinary teams. We've had a state legislator attend one year that kind of talked about if they identify any needs, the process of trying to implement anything from a legislative standpoint. We've had our collaborative partners such as the Kentucky Attorney General's office have came and presented on scams, how to identify scams, exploitation. So we try to keep those recognition events informative for the council so they can go back and share what they learn to their community and to the other council members. We also, as I mentioned, they have Facebook pages. Within this past year, the liaison has developed a monthly newsletter that we send out to not just the coordinating councils, but we also send it out to our adult protective service staff throughout the state and anyone that's interested. And the newsletter has information about what's going on, any legislative updates. We usually try to have a spotlight in the newsletter from our collaborative partners that we work with, like the Office of Inspector General. The Attorney General's office will be in that newsletter, and they will talk about what they do, trying to educate on how we work together and what each agency's role is, anything of importance that's going on that pertains to elder abuse or adult protective services is information we try to share in the newsletter that's informative. Next slide, please. At this point in time, the local coordinating councils have not been evaluated. We have had if we can move on to the next slide. We have had discussions on future plans on moving forward. I know the liaison has sent out a survey. We've met a couple of the last calls we've discussed. Is there a need for data? What data would the councils like to see to help try to steer their prevention efforts and evaluate effectiveness on how effective they feel like they're being within the communities they serve? Right now we're still in the discussion stages of, how would we collect the data? What would be most effective data to collect for those councils? How could they access it and share it? The current data that we have available now to the councils is within the Kentucky's annual elder abuse report. This report, the data that's housed in this report is statewide data, so it doesn't break it up within like counties or regions of the state. But the data, that's the data that we usually refer if the councils want to go out and do any trainings or if they want to talk about APS, Adult Protective Services data. This is typically where we refer them. So at this point in time, we're just kind of in the discussion stages on what would be beneficial to those councils to help them try to evaluate the work that they're doing within the state. Next slide, please. I think that concludes my discussion on the Kentucky's local coordinating councils on elder abuse. Do you all have any questions?
Okay, folks, how about some, let me see here, the chat. Joanne, why are we pushing so much from MDT rather than interdisciplinary? Joanne, I'm not sure what, let me see. Joanne, can you unmute yourself? I'm not seeing you.
Yes, I don't think, sometimes my computer goes in and out, but with multidisciplinary, a lot of times for everybody together for that type of meeting, we just do not have the time to do those types of things. But we are planning to do education sessions about AP, let the community fill us in on what is going on in their agencies as well. But we push interdisciplinary, where we want every department to do their part and be hands on deck And I just feel like we need a lot more push in that area because there's a lot of dumping of agencies, and APS gets dumped on a lot. So, you know, we just want to make sure everybody's doing their part and everybody has an understanding. I think that's where our focus is, because in APS already has it set up so nicely so that, you know, that we have to contact everybody involved in this report, you know, and so we get everybody involved at that point. So really get set up to make sure everybody's included in the discussion of the adult.
Okay, is this, Joanne, do you feel like this is a question that Dr. Teaster or Stacy can respond to, or are you looking for an answer, or?
Yeah, I think Dr. Teaster, she responded to me privately.
Oh, okay.
And she said she thought it was a good idea too. So
Is it anything that the rest of us might learn from Dr. Teaster?
Well, I hope you can hear me. I'm going to change my background just in case that will help a little bit. See if I can make that work. If I can.
You're still a little garbled, but we'll do the best we can.
I'm gonna try to, I can't seem to solve it. Like it's not responding. I responded to Joanne and I said that really she's right, that multidisciplinary is the easiest one thing to have. This just showed up, so we'll try to make this work. Deal with my bandwidth.
Yeah, it's real hard to hear you, so.
All right, there's that. And then there's me, and I really am. And then I'm gonna, that might help some. I'm gonna stop my video. That may help a little too. So she's exactly right that multidisciplinary is just people coming together, working together. But interdisciplinary, you understand what people want to help to help solve a problem. You really get into their discipline a little bit and understand that. So anyway, that's a possibility. And I wrote Joanne that she's exactly right. Multidisciplinary is an easier lift, and that's not easy.
Any other questions for Stacy or for Dr. Teaster? Stacy, did the state of Kentucky ever fund then I'm a little unclear. Did they actually authorize some funding for the councils?
No, there's no specific funding that is designed for the local coordinating councils on elder abuse. And that's conversations that we've had, you know, within, as we move forward with the statewide elder abuse committee, you know, discussions around, you know, that's an issue, a challenge for the councils. My branch, we have an awareness budget, and we utilize each year a little bit of those funds. That's how we promote the annual recognition event, and that's how we host that. We use those funds for that because they're in relation to elder abuse awareness, but there's no specific